Okay, so what we're going to talk about here
Briefly.
is leukemia. Basically, that's why this gets thrown in with the hematology lecture. So we're focusing in on leukemia, but overall, when we talk about cancer, some of the signs and symptoms you can see. Leukemia is a type of cancer that does not have an organ. I mean, yes, it starts in the bone marrow, but there is no tumor. There is no organ per se, if that makes sense. It can be found, leukemic cells, which are immature blood cells, can be found in the CNS, in the meninges, in the CSF, CNS, and the central nervous system, but in the CSF, cerebral spinal fluid, when they do epidurals. It can be found in the blood, obviously it's found in blood. It can be found in lymph nodes. It can be found in bone marrow, obviously when they do the bone marrow biopsies. So, but it doesn't have a tumor per se, if that makes sense. There's no like in other things we talked about this semester, we talked about nephroblastomas, neuroblastomas. There's a tumor somewhere in an organ that's going to be removed and hopefully didn't metastasize. And then if it did, we might have to give radiation and chemotherapy. Sometimes you do those first and then you do the surgery. Sometimes you do the surgery. It all depends. We have Memorial Sloan Kettering right down the road, so sometimes they'll say, I've worked with them in a few of the patients because they go for second opinions, and pretty much with cancer nowadays, everybody's on the same page. You know what I'm saying? Like they're following protocols here at Trinitas's Cancer Center that Memorial Sloan Kettering is doing there. Unless there's some sort of rare cancer somebody has, and then they might be doing research somewhere else. But for the most part, everybody's kind of on the same page. But you will sometimes get a doctor will say, well, let's do surgery, and then we'll do chemotherapy. And some will say, let's do chemotherapy and radiation, hopefully shrink and contain the cells, and then do surgery. So sometimes that's why people go for their opinions to find out stuff. But those are the three modalities, basically, with cancer. In this case, though, there's no tumor. So we're talking about bone marrow that's no longer producing enough mature cells. They're producing immature cells that are red blood cells, white blood cells, and platelets, but they're immature. And that's what defines leukemia. When you have a percentage that's immature, that's too much from what it should be, that's what gives the leukemic diagnosis. That makes sense, okay? So what they're doing is they're checking the blood levels, and everybody's going to have some immature white blood cells, or immature red blood cells, or immature platelets even. But when that level becomes too high, then it's considered a leukemia, because now you have too much of the immature cells and not enough of the mature cells. What does that manifest as? Well, you can see.
It's not just a white blood cells, it's all
That's right.
blood cells.
It's all the blood cells, yes.
It says leukemia and we know leukemia.
Exactly, white, exactly. But there really is issues with red blood cells and platelets too, where there's, there's different types. So you can get like ALL, which is more of the white blood cells, although again, there are a little bit off on the red blood, and that's very treatable. 80% prognosis is 80% success rate to treat that with just chemotherapy alone. Then you get AML with acute myelogenous leukemia, and that has higher levels in all of them of immature cells. That has a poor prognosis, and then ANLL has the poorest prognosis. So again, it kind of depends on the type, but definitely you can see things like, okay, so fever, okay, because the white blood cells being decreased, and a hypermetabolism, hypermetabolic state that the body's in, because with these immature cells, it takes up a lot of metabolism and energy. So obviously you're going to get some, you can have some decrease in weight too, which a lot of cancer patients do get. Pallor, because of the decreased red blood cells, loss of energy because of that. And even the changes in personality. Balance and gait can be issues. Purpura, which is from the decrease in platelets, you can have bleeding. Thrombocytopenia, what they call. Unexplained weight loss, again, with the hypermetabolism and increased energy. Early morning headache and vomiting if there's actually leukemic cells in the CNS. Because there are cells where there shouldn't be, so it can sometimes cause issues with CSF fluid balance, even too, so it can cause those things. Principles in pediatrics, children who are ill usually recover very quickly and completely, and so it's a very good prognosis with a lot of the leukemias nowadays, except if it's the more rare types, as I was mentioning. So the risk of cancer treatment is the development of complications secondary to the cancer treatment. What does that mean? Melissa?
If you're treating it, you may have decreased immunity from all the chemo, and then you get secondary infections.
They will actually, these patients, even though they're decreased, we talked about the white blood cell counts being decreased and more immature cells are there, they actually, once they start this chemotherapy, it can sometimes put them into an aplastic anemia where now they have nothing. Before they had a little bit, now I have like no defenses. So the complications of the chemotherapy are sometimes worse than when they had the cancer themselves, but obviously it's needed. You know, so, but again, it puts them at a very high risk for infections, bleeding, you know, anemia, those sort of things. And again, we have a lot that we can do that can help counterbalance that. Nowadays, there is something to counterbalance everything. You know, they are working really well with that. So they have, they can give, you know, erythropoietin to help stimulate red blood cell quicker, but they also give packed red blood cells. They have something that can stimulate white blood cells before they reach that nadir point where they can't make them anymore. They actually stimulate them before. So there's things they can do. And again, not so much with leukemic patients because they're not making them properly to begin with, but somebody who has some other kind of cancer that needs chemotherapy. They have a lot that can counterbalance it. And again, the 4 systems are most affected are the endocrine, the reproductive, the central nervous system, and the skeletal system, because there's fast-growing cells there. And chemotherapy attacks fast-growing cells. So complications are septic shock from an overwhelming infection, anemia, and hemorrhage. Children with cancer, again, children receiving chemotherapy should not receive live vaccines. They do contraindicate in your book, so I want to bring this up here. In this chapter it says 3 months, but in other chapters it says 12 months. What I will tell you is most practitioners will now stick with the 3 months. They have gone back. It used to be more conservative and say 12 months. Now they'll say 3 months post, you can have vaccines again, because they do have a lot more that they can do to stimulate the immune system to keep it healthy.
That's for life.
Not for, no, not for life. It's for post-chemotherapy. Like obviously while patients receiving chemotherapy, you're not going to want to give them live vaccines.
Live vaccine, but
Correct.
just a live one, not a regular
Correct,
vaccine.
that's right. So they can get other vaccines, not live vaccines. You don't want anybody in the household getting live vaccines either while they're under chemotherapy. 3 months post, once they've done their last chemotherapy injection and they're done, and it's been 3 months, then they can. What were you going to say, Stephanie? Do you need something else?
How dare you? I'm saying that God actually told me, like in the book, it said for the other diseases that we've gone over, the same thing, that it said, like, for stuff for today, the test, is it 3 months for those too?
Yeah.
Like on the slide, it said 3 months, but the book says as well, so for everything.
No, yes, and the book does, and actually in this chapter it'll say that 3 months. Yeah, 3 months is pretty much their new. Now, there are certain diseases you want to go to the 12 months. Like when you give IVIG, you want to wait 12 months. But chemotherapy is 3 months. I think that's why it kind of can get confusing.
Yeah.
Yeah, IVIG is for the exam, so 12 months for that, 3 months for chemo. Yeah, because again, they can give you stuff to stimulate the immune system quicker, so they don't have to wait as long. Does that make sense with this anyway? Siblings can get the MMR and varicella. Those are not live, actually. If a rash develops after the varicella immunization, the child with chemo treatment should avoid contact with the sibling. Hepatitis B is recommended. You know, it's one of the ones. And the more they experience the cancer treatments, the more sometimes emotional support is needed. Kind of opposite of adults. Sometimes people say, oh, now they know what to expect. They don't need as much. But sometimes they do need. Okay, you can put it in here.